I think I've heard of that. In fact, I believe that's what Rudy Giuliani had.
I don't really know what
brachytherapy, is it called?
Yeah, something like that. That's what it's called. But in general, it's they implant radioactive seeds, and that's the idea. Now, the problem with radioactive seeds is sometimes the seeds can migrate and cause side effects in other parts of your body.
I see.
So that's not necessarily a good thing.
And another option would be what?
Another option could be regular radiation, which we call X-ray radiation, or photon, P-H-O-T-O-N, regular radiation. And that's where they radiate your prostate to kill the cancer cells. The problem with that is regular radiation. The radiation comes in at a high level. By the time it gets to your prostate, it's reduced. And then the radiation still continues through out the other parts of your body. So you have a greater chance of affecting other parts of your body, other parts of your body, and that could be a problem. It could affect your rectum, it could affect other parts and cause other kinds of symptoms to your body, which you don't want to do. You do not want to radiate any more than the prostate, if at all possible.
Okay. So which one of these is the more common now? You said most recommendations are made for actual surgery, but a lot of people get radiation, and a lot of people choose seeds as well?
Yeah, a lot of it depends on your age. A lot of doctors after a certain age, I think it may be 65 for some doctors, they will not perform surgery.
Okay.
So they will then recommend seeds or regular radiation. In some cases they recommend what we call watchful waiting, which is not really a good idea. If you're like under 85, I would not recommend watchful waiting.
Which means what? Just
wait and see
anything?
What happens, because most cases of prostate cancer are slow growing. And if you're old enough, chances are you'll die of something else before you actually get a major symptoms of prostate cancer and then have to deal with that.
Okay. Well, Allan, we're going to take a short break here, but when we come back, we'd like you to tell us about what you chose as a treatment, the proton beam radiation therapy, how you found out about it, and why you chose that over the other options. So we'll be back in just a moment to continue our discussion with Allan Kaufman. Welcome back. We're talking with Allan Kaufman about prostate cancer and about the various treatment options that are available. So you were faced with a decision then, Allan. How did you go about doing research and finding out what options were available? What did your doctor or urologist suggest to you?
Well, what happened to me was my doctor called me up on a Monday after I had my biopsy a couple weeks later, and he said, Allan, can you and your wife come in tomorrow? And I said, does that mean it's positive? If he wanted to talk to me and my wife at the same time. I said, well, I don't think we can come in until Friday. My wife's a teacher. She said, that's fine, not a problem. Come in on Friday. So I had a week, almost 4 or 5 days, to actually do some of my own research. And I immediately went online and I started researching prostate cancer. I knew nothing about prostate cancer. Initially, I came across something called robotic surgery. Well, robotic surgery is basically the same as surgery, except that the doctor uses a robot, kind of a gizmo, and it's more targeted, it's less intrusive. You don't have to be in the hospital for 2 days, only 1 day. You don't have to donate blood in advance. So that sounded kind of interesting, and I was kind of like leaning towards robotic surgery, not knowing anything else at the time. Well, the next day, I found out from one of my daughters, and I had told my daughters, I have 3 daughters, that I was diagnosed with prostate cancer. So my middle daughter, Amy, found out that somebody in her office, his father had been diagnosed with prostate cancer 2 years earlier. And he had gone to a place called Loma Linda, California, to Loma Linda University Medical Center, to have treatment, some kind of treatment called proton beam therapy. So she said, this looks really interesting, and she got a lot of information from this guy, in fact, from this particular guy who worked with her, and she overnighted me about 50 pages, a package of information. And I was looking at it, and most of the information included like 100 testimonials of all kinds of different people who went out to Loma Linda to get proton beam therapy to cure themselves of prostate cancer. It was unbelievable. Doctors and lawyers and accountants and truck drivers, all kinds of people from all walks of life went out to Loma Linda.
Now, this is a form of radiation therapy, isn't it?
Yeah, it's a form of radiation therapy, radiation treatment. So anyway, so I got this information. I started doing a little bit of research on it. And then it was recommended that I actually call up the guy's father, the guy who actually had proton beam therapy treatment. So I called him up and spent 90 minutes on the phone with him. And he was telling me how great this treatment was. He had a great vacation in California while he was out there getting treated for prostate cancer. Anyway, meantime, I went to my doctor, and my doctor gave me all these various options, the main one being surgery. And he said, if I really wanted robotic surgery, he doesn't do that, but somebody in his office could do that. And then he told me that of all his patients, within 3 years, 75% were no longer, after surgery, 75% were no longer impotent. I said, what?
Were no longer impotent.
Yeah, I said.
That means they were for several years?
Yeah, so that kind of implied to me that, wow, you have surgery and your chances of being impotent were pretty high, and there could be a 25% chance that you could be impotent permanently. And he didn't even talk about incontinence. And when I talked to this friend, this guy, my daughter knew the son, he told me that a lot of his friends had had surgery, and they were incontinent. They had to wear pads and this and that. I also talked to my regular internist, and I mentioned it to him, and I told him what the urologist said, and he told me, my internist told me, that he had 30 of his patients who had previously had prostate surgery, and they were all incontinent and impotent. Well, that did it for me. I was not. Found out later that 1 out of every 200 guys who have surgery die on the operating table. So after talking to this guy and after doing some more research, and I even called up, a guy in California called, whose name was Bob Marchini. Turns out this guy, Bob Marchini, is like the guru of proton beam therapy. I say that because he had it done 8 years before I did, and he formed an organization called BOB, Brotherhood of the Balloons. He wrote a book about prostate cancer and all the various treatments, and also talked about proton beam therapy. So after doing much research, I decided this was the way to go, and then I started the ball rolling.
Now, you mentioned the Loma Linda Medical Center, which is a famous medical center in Southern California. Are there other locations, or did you just know about this one, and that's where you wanted to go?
Well, I was diagnosed 2 years ago, and I was 58 years old at that time. At that time, there really weren't any centers that were really focused in on prostate cancer using proton beam therapy. I think there was a couple centers just being opened. Now, there are about 6 centers open, and they're building like 20 more. Right now, they have one in Jacksonville, Florida. They have one in Texas. They have one in Boston. They have one in Indianapolis. They have one in Florida. So you can go to various ones and get proton beam therapy treatment. However, having said all that, Loma Linda's been doing it since 1990. These other places have been doing it a year, 2 years, maybe 3 years. Loma Linda has it down to a science. They've been treating it since 1990, and over 12,000 men have been treated at Loma Linda.
So just specifically, how does this proton beam radiation therapy work, and how is it better than the others? Are you saying, in effect, there's fewer side effects? That's
the key. Because the way it works, Andy, is that proton beam therapy, the treatment, they shoot radiation, highly targeted radiation, using that super expensive machine. Highly targeted radiation comes in at a low level. When it gets to your prostate, it peaks. So you get maximum radiation at the site where you need it, at the prostate. And then it stops. It does not go out and affect other parts of your body. So your chances, your probability of getting major side effects is much, much lower.
I see. And so how often do you have to get this treatment?
Well, the way it works is you have to move, or unless you live close by, you have to move out to where the center is. I live in the Baltimore area. So I actually had to move to Southern California, to the Loma Linda area, for 2.5 months because I had 44 treatments. Each treatment, I had a treatment each weekday, Monday through Friday. We're off for the weekends. So I had a treatment each weekday, and each treatment took about an hour. The actual treatment itself was about 60 seconds. But it took me an hour because I had to go to the center, and I lived about 5 blocks away. I rented an apartment. It turns out in Loma Linda, they have a whole community that's geared to helping people who are going to Loma Linda University Medical Center. So they have apartments for rent. You can rent apartments for 2 or 3 months at a time. It's unbelievable how supportive it is.